Okay, take away, Sarah.
Good afternoon, everyone. It is with great pleasure that I would like to introduce Brian Finley. Brian was the creator of IAVaccineAlerts, and I am sure that he has saved thousands of lives with his program. I know of at least 10 people that got their vaccines from using the Twitter account. Brian graduated from the University of Iowa with an undergraduate degree in theater arts. And then he got a master's degree in journalism and a master's degree in library and information science in 2009. Brian worked at the University of Iowa as a developer in various IT groups on campus. And then at the end of 2021, he took a job with Proxy Bid Incorporated, which is based out of Omaha. And I'm very excited and welcome hearing about this. As a COVID long hauler, it's very important to me and very personal. Thank you.
Okay, so I really don't have a clear picture of sort of what everybody's going for here, but if there are ever any questions or things you want me to expand upon, you can again save till the end with the questions, or feel free to interrupt me at any point. This isn't super structured on my end, so yeah, just a quick background on me. I'm kind of a Iowa City, Iowa lifer. I moved here when I was about 10 or 11. And have lived here since. So wasn't born in Iowa, but got here as soon as I can. Is that the overused phrase that everybody says? But I didn't really get into tech stuff for school or anything. Like I said, library science, journalism, not exactly the most technical side. It was just always something that I did on the side as something fun to do and learn. And so when I graduated and didn't know what I wanted to do in the actual real world, I just started working here at the U. Worked in ITS for a while, and then jumped over to ICTS in the hospital, and then back over to ITS a couple of years ago. But when the pandemic started, it became pretty clear that there wasn't a great plan, I guess, for vaccine rollout in the state. They weren't quite sure they weren't quite sure how they were going to distribute it. You know, there was so many unknowns regarding availability, when shipments were coming in, all that kind of thing, combined with just general disorganization at the state and county levels. And so when the appointments started showing up, it was kind of a last man for themselves, Black Friday kind of situation. A lot of people compared it to Hunger Games. I chose Black Friday just because it was a little less dark and violent, but at least less dark. I don't know about violent, but the way that this all began for me and my involvement was whenever that first set of like secondary conditions that came in, when diabetes, obesity, hypertension, those sorts of things came in as qualifying factors. I think it was March 8th was the first day that those went into effect in the state of Iowa. I have a lot of people in my family that are affected by that. My mom has heart issues combined with some diabetes. And so we were really working hard to try to find her a spot. And at that point, I think Hy-Vee was kind of the most reliable, and I may have been the only place in the state that was offering it that very first week. And so I had spent the better part of 4 or 5 hours, I think that Saturday before, trying to find appointments for me, my mom, my mother-in-law, basically anybody in my circle that I knew that needed an appointment, especially those that maybe didn't have the greatest tech skills. It was a lot like buying concert tickets, where it was, you had to be there when they went live and they were gone within minutes. And if not, you were kind of SOL. So I spent 4 or 5 hours there, running back and forth between my computer. I've got 2 kids. I've got a house with my wife, and it's just, it took me out of commission for the better part of an entire weekend day trying to figure this out. And towards the end of that day, I started wondering if there was a better way. When you were on the Hy-Vee website, if you put in a city it would only search within 10 miles of that city for any available appointments. And that seemed ridiculous. You know, there were a lot of cities in Iowa, a lot of tiny, tiny towns in Iowa that you've never heard of. And so I dug a little bit into the code on the website. I did not hack anything. I did not bypass any security measures, but I went out and found a way to increase that search radius from 10 miles to basically hundreds of miles to get a listing at any point of all of the appointments that are available in the state. And so what I was able to do with that was I worked up a little bit of code that let me check every couple of minutes. I think I set it to 5 minutes or so, just so I wasn't flooding Hy-Vee with crazy requests. And then every 5 minutes, it would check the list of appointments and it would spit out a list of cities that had open appointments. And if there was a new city in that list, it would play over my speakers in my house like a big loud bing bong, and I would go running downstairs and, you know, register my grandma or my aunt or whoever sort of was next in line to get their shot. Luckily, I'm pretty thankful all my family was on board with getting the shot. I didn't have to convince anybody, which I know is a rare occurrence, especially in this part of the country. But so after I got those appointments, it was like, okay, well, this feels kind of important, right? Like this, it would have felt icky to just throw that away, to turn it off and kind of move on. And over those next couple of days between Monday, Tuesday, and Wednesday, I started trying to figure out how to get that out there. There was another group that had been doing some stuff nationally called Vaccine Spotter, which kind of provided some national based data that I eventually incorporated later, I'll talk about. But they brought that online to sort of cover the national side. And then a guy named Todd Brady had brought up something similar, map-based, focused just on the Iowa availability. But there really wasn't anything that was a push message. You know, there wasn't anything that you could sort of set it and forget it, go about your day. It took me out of, I'm super tech savvy, and it took me out of commission for a day. I couldn't be a parent. I couldn't be a partner. And so I wanted to find some way to help get it out as a push, and Twitter seemed like an easy answer. Even the less tech savvy among us can usually operate Twitter. And so using a number of different kind of integration tools, some of my code, some code that was already online, I basically started tweeting out when those changes happened. So every couple of minutes it would search and it would tweet out, hey, something changed. Here's the list of all the cities. That went out on Wednesday night, or I think Wednesday morning. Yeah, went out on Wednesday morning. I registered IAVaccineAlerts, just kind of put it out there on my personal Twitter account, and said, hey, I'm doing this thing if anybody's trying to find an appointment. By that night, I had like 1,200 followers, which I thought was like the coolest thing ever. I'm like, oh man, so many people. By the end of that week, there were over 30,000 followers, I want to say. Everybody was sharing it with everybody. Everybody was tagging friends and folks and stuff. There were, some iterations in the code to make things a little easier to understand, a little easier to view. There were some suggestions I had for people that didn't want that flood of push notifications, some ways to kind of filter their feed a little bit, for only the cities they'd be interested in. Retweets from some folks around the state of Iowa, big name government type people, elected officials and things that really spread the word really well. And it just kind of took off and took me out of commission again. Like there was no time to do anything else. There were replies coming in. Finally, by that Friday, I learned to turn off I decided I had the self-control to turn off the push notifications to my phone so that I could step away and kind of do what I had started this whole thing to do, was to still be able to be a partner and a parent and my 9-to-5 job, I guess. Yeah, some got to do that. But mid-afternoon Friday, things kind of took a negative turn on the social media side. There was starting to be some, I don't want to call it backlash, because it was all well intentioned, it was all civil, but it was bringing up questions about, okay, there are a lot of tiny towns in Iowa that are suddenly getting basically vaccine tourism, where you get people driving across the state to some town they've never heard of because they're the only places that have appointments. And there was a lot of discussion, a lot of really heated discussion going on in the replies as to whether this was an overall positive. You had people in these tiny towns angry that people were driving in from Des Moines and Waterloo and Cedar Rapids and Iowa City because there just wasn't that supply available there. That really threw me for a loop and brought up some really good sort of equity access questions that I definitely was not equipped to answer. And so I reached out throughout the couple of days leading up to this. There had been plenty of doctors and pharmacists and nurses and such that had sent me DMs like thanking me or giving information about a local clinic, things like that. And so I'd gotten in touch with the pharmacists and other medical professionals that had gotten a hold of me. And I said, especially public health professionals that deal with this kind of stuff. And I kind of laid it out. I'm like, is this a net positive? Is there something I can do differently? Is there, and the response I got was, this is kind of at the center of any public health issue. There's certainly positive about getting shots in as many arms as possible, especially when you're talking about heading toward herd immunity or whatever, whatever the goal ends up being. And they basically said, do your best. There's no way that you're going to be able to get everybody a shot who wants one as soon as they want it. But at the same time, really make a concerted effort in your messaging to bring other people along. And so starting that Friday night, I started sending out a lot of tweets about sort of using this information responsibly. Spider-Man's coming out soon. With great power comes great responsibility. And I'd heard some really awful stories about people who registered for their shot and it was a 4-hour drive away, but then the next day they found one that was 30 minutes away. And so they just blew off that previous appointment. And so whenever I would send out a message as myself, not these automated tweets that were going out, I, almost kind of tried to guilt trip people into that and think about if it's worth that drive. We expect there will be enough availability for everybody who wants one within the next couple of weeks. Is it worth driving 5 hours twice over the course of 2 weeks because of the 2 shots at that point? And then the other thing that I really tried to do was get people to look around them, look in their family, look in their neighborhood, look in their, their church groups, their social circles, whatever it might be, and try to find people who may not have the technology or have the time or have the technological know-how or whatever barriers they might have to getting these appointments. You've got yourself your appointment. How can you find people around you to help? And that kind of spawned a group of people that was kind of organized in DMs and stuff, and we're sending out Google forms, helping people register their appointments. They were, I talked to several high school students that had kind of gone into senior centers and stuff, and were helping basically there with their laptops all day, trying to help the old people get registered, whether it was just, senior activities or whatever it might be. I told people, your family, your aunts, your uncles, the lady down at the bingo hall, the old guy down the street that's always working on his lawn, no matter what, like just, try to find and do what you can to make sure that everybody gets their access. And so some of these people that were putting out these Google forms and getting folks registered, were getting upwards of 1,000 individuals registered for these shots just in, their Google forms and through these contacts. I had my Kirkwood Spanish teacher. This would have been, I had her 20 years ago. Bridget Malone had gotten a hold of me and was like, okay, I've got my appointment, but my dad's girlfriend is having trouble getting an appointment. If I give you her information, can you get her an appointment? And so I took it down and got her the appointment, and it ended up with us talking on the phone for like an hour at 10:30 at night, just reminiscing about how everything's gone and stuff. And so really, I think that's where it kind of turned and took off into a pretty strictly positive situation, was urging people and people stepping up to the plate to get other people registered. There are also still plenty of access concerns that I couldn't address, whether it was transportation to and from these places, whether it was folks that were concerned about providing ID, undocumented individuals, homeless individuals, things like that. And I tried to address those as best as I could in one-on-one spots. I had kind of in each community, I had found kind of a safe person, a safe pharmacist that, was sensitive to the issues of undocumented individuals, that, I could kind of say, hey, I've got somebody coming in at this point. They're undocumented and they're really are nervous about providing any kind of information. And they were kind of there to receive them and shepherd them through the process in a safe and respectful way. A lot of pharmacists, especially in small towns, may not take, even though they may follow the letter of the law and issue the shot, they may shame and just generally be rude to some of those types of clients. And that's unfortunate. And so I wanted to make sure in some of the larger communities, especially with populations that are in need of that kind of discretion, I wanted to find kind of one person that was that I could direct folks towards. There were those kinds of access concerns. There were just physical access to the spaces. Being at a lot of grocery stores and stuff, they've usually got that pretty well handled, but especially with regards to transportation, there were several people that I tried to help. Some were not as receptive, which I definitely understand. It's not something that folks should have to worry about, finding reliable transportation. And I tried to walk that line between wanting to help and not coming in as sort of, hey, it's the able-bodied savior coming to save the day kind of thing. Like I understand the frustration, and there were some people that just needed to vent and get that out, and that was fine. And I did what I could. And eventually, after this was running for a couple of days, I think that Friday it started getting a lot of media attention, and all the news stations started calling and interviewing and asking questions and getting it on all their newscasts and newspapers. And my family would call me and be like, hey, I saw you on the 6 o'clock. And I was like, oh, I thought I was going to be on the 9. And my neighbor knocking on my door, handing me the copy of the paper with my face on it. And I'm like, yeah, I know. We just moved last year, just middle of the pandemic, pregnant wife, middle of the pandemic, moving to a new house. But we moved into a neighborhood with a lot of old people. And so everybody's very friendly and always wants to talk about everything, which is nice and wonderful. But sometimes I'm in a hurry. I just got to get the kid out the door and to school. But anyway, that really increased the awareness. And I think, everybody was kind of looking for good news at that point. I know John Krasinski had that some good news that was like a sensation and gave me some ugly tears at some points during the pandemic. But as it kind of took off, I had folks from other states reach out. I had friends that had family in other states or friends in other states asking if there was anything similar. And because of the way the code was written, it wasn't a whole lot of work to spin it up for other states. So over the course of a month or two, I had Minnesota, Illinois, Nebraska, Missouri, and I think maybe Wisconsin for a little bit. They were all kind of just running as scripts on my in the background on my computer, sending all these out. None of them kind of took off as intensely as Iowa did. I think couple of them got over 1,000, couple thousand followers, and that's fine. I'm glad that everybody, was able to get what they were hoping for. But because it was so easy to kind of duplicate the code and just change the parameters, I eventually started using some other external resources that were available. Like I said, Vaccine Spotter had some really, really cool screen scraping technology, like using some screen readers combined with like automation tools to bypass a lot of sites that made it really difficult to collect that kind of information. And they would then pass that out in a JSON format, which was just a really easy way to consume and use that data to make your own tools and information and stuff. So I leveraged them, and that was able to get me Walgreens, CVS, Walmart, Sam's Club. And with those under my, the kind of Midwest grocery stores were all pretty covered. And so it wasn't like I had to go figure out how to get Wegmans. Like, I don't know Wegmans. I've never, Meyer? No, I don't know. So at some point it got a little rough out of pocket, especially once multiple places were spinning up. I was sending out, I think I got rate limited for sending out over 2,000 tweets in one day. So I had to kind of pull back. I found ways to only tweet out the bits and pieces that had changed as opposed to tweeting out the entire list every time. And then the integrations that I were using, I kind of hit the free tier limit and had to pay out of pocket. And so there was one morning that I kind of put out there. I'm like, hey, this is I didn't want to have to do this, but it was, getting to be like $400 or $500 out of pocket for me. If there's anybody that's able to help or kick in a few bucks here or there, that'd be great. Just to cover my stuff for this, I'll post accounting and all this stuff to prove where it goes. And I put my Venmo out there, and 10 minutes later, I had to take that tweet down and beg people to stop, as they'd given me $2,700. I was like, please stop. Like, people were still passing it around and like screenshots and retweets. I'm like, so I paid the couple $100 that I needed to my server costs. I think bought another month ahead, and then divided up whatever was left through 10 other charities that were around the Midwest. I reached out to all the people that were helping in DMs and helping other people get registered. I asked what projects meant a lot to them. And so we were donating, I think it averaged being like $280, something like that, about $300 to a number of different charities. Let me pull up that list real quick, just so I'm not forgetting anybody. But I posted this all as a, it's not showing up. Anyway, charities like NAMI, it's a mental health charity. I want to say the Washington County Animal Shelter. I think I did UAY. I did the Multicultural Development Center in Des Moines. Just anything that kind of rang true and resonated here. At about the same point, I was approached by Raygun. They were happy with what I'd done and wanted to do a t-shirt to raise money for whatever charities I picked. And so I ended up getting my own t-shirt, which I think was really cool. There's been there've been some random awards here and there. The Governor's Volunteer Award. I'm not a huge fan of our governor, but when Raygun wants to make you a shirt, you've kind of hit it. I was like, yeah, now we're in the big time here. So we were trying to figure out what was going to be on the shirt. And I had a woman direct message me and say that they got their appointments, they got their shots and whatever, but her 7-year-old daughter was having a tough time dealing with kind of the isolation and the disruption of her school and her activities and her friendships and things. And her mom had kind of pulled her aside and shown her my Twitter account and gone to the kind of Fred Rogers, like, when things get scary, look for the helpers, and I thought that really touched me, because my son's 5, and that's kind of something that we're pushing for him as well. Like things are going to be scary sometimes, but look around and see what other people are doing to help, how you can help. And so the shirt literally just says, be a helper. It's not look for the helper, it's be a helper. And the proceeds from that went to the United Way of East Central and Central Iowa, as well as the Iowa Public Health Association. I wanted to make sure to get the Iowa Public Health Association. I can't remember her name off the top of my head. This was 6 months ago now, but she was one of the ones that really helped calm my brain during that first rush of, is this a good thing? So between her, some pharmacists that I talked to, and my therapist, that's really what kept me from shutting it down 3 days into it. And so I really wanted to find a way to put that back, to return that favor for them. I also worked with them a little bit about how to get messaging and get some of these appointment availabilities into communities that are typically harder to penetrate, especially with public health messages. They had I think their Hispanic community was particularly more on WhatsApp than Twitter. Like that's how they communicated and stuff. And so we started trying to find ways to get those messages pushed out there, or find certain ways to get these appointments pushed to Facebook to kind of, cover the Venn diagrams of where people may overlap. I had no issue with people reposting them to Facebook, but the absolute last thing I wanted to do is get into vaccine discussion on Facebook. So I said, whatever you guys want to do with the information I put out is fine, but I am not wading into those waters right now. And so that's kind of where it went. Eventually the supplies caught up. It got to a point where if there were appointments available, it was because people in those towns didn't want them, which is frustrating. It's pretty, you'd pull up the map of where appointments were available, and it was pretty obvious that it was, Western and Southern Iowa. I shouldn't get political, but I don't work for the university anymore. Kind of Steve King country, we'll say. But and so eventually it just got to a point where it was time to shut it off. It was just kind of flooding people's timelines, and I didn't want it to get to be an annoyance. I wanted to keep some followers around in case, as we came up on boosters and as we came up on kids, I wanted to make sure that this was still around to be able to push things back out. I had people, whether it was reporters or people in replies and DMs, trying to tell me to run for state office and stuff, and I'm like, absolutely not. I did this to free up my time. State politics is the last thing I want to do. But Todd Brady, who did the map side of this, which also helped tens, if not hundreds of thousands of people find their appointments, he is running for state senate. I think in the whatever district Ankeny is, I want to say. But so he took that bait, and he's going for it, and he's still pretty active. He started up Test Hunter for people trying to find retail availability for both pharmacy test appointments, as well as in-stock places for the at-home tests. That's gotten a little bit easier, but it's still an issue. I'm guessing he'll be getting a lot of traction now that it seems like private insurance is now going to be required to cover those. Like I said, the recognition I've got is cool. I mean, I saw an award from the Iowa City Coralville Convention Visitors Bureau, something. They recognized some way cooler people than me alongside me. It was the head of the hospital, it was Roy Sam Porter, it was Sam Jarvis, and then it was me. I'm like, I don't belong in this group of people. The Iowa City, I'm blanking on the name, the Human Rights Commission, the Iowa City Human Rights Commission, recognized me again alongside all these super cool people. But it was funny because at the breakfast lunch, or the breakfast award ceremony or whatever, the head of the Multicultural Development Center, one of the people that I donated to, was at there, and as I was speaking, I called him out, and he was like, "Yep, I remember," like thanking me back. So I was like, it's kind of cool that we're mixing in these groups, and so I really, like I said, I'm not trained to do any of this kind of public good stuff. I just kind of saw a need, saw that I had something that I felt could help some people, and just kind of fired it off from there. I've still got the code in case for some reason we need it again. Even with the rollout of kids vaccines and boosters, it's not been as near as crazy as it was that first week. So there was never a need to kind of scrape for appointments, but as the kids came online with their eligibility, I did kind of have a week there where I was retweeting a lot of like clinics and, this place has it, and here's the email from the Iowa City schools where all the clinics are happening, or things like that. So it's kind of calmed down now. I don't know. Occasionally I'll get a email from a reporter or something wanting to do just kind of like a post, like a debrief. I don't want to say postmortem, but a debrief as to kind of where we're at and if I'm still around. And it really opened my eyes to how tough it is to cover all the bases. I just put this thing up, and then 5 days later I was trying to figure out how to solve accessibility and equity and availability and just all these problems that I never had really considered. And I have mad respect for those who are able to wrap their mind around that kind of stuff, but it just kind of solidified my belief that I'm meant to be stuck behind a computer screen writing code, talking to like 4 people every day. So that's, I think, is about all I have, like, as in terms of me just talking at you. So unless there's anything I forgot to cover, I'm looking at my hastily constructed list. I think I'll probably open it up for Q&A now. Is that where we're at?
Yeah, that sounds like a good plan. I'm going to stop the recording.